You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. In studio today, we have New Jersey's implant dentist, Dr. Champagne. Dr. Champagne, welcome to the program.
Thank you for having me.
Now, for people that don't know your practice, I mean, who's the typical patient that you see in your practice? Because you do more than just dental implants, and you've got this theme where you do everything under one roof.
That's
Tell
correct.
me about that.
That's correct. Our typical dental patient can range anywhere from somebody who just wants simple tooth whitening, a checkup, a cleaning, or all the way up to dental implants, which is really some major dentistry that changes people's lives. And what we've done is over the last couple of years is put together New Jersey's premier dental implant team, where we have the surgeons, the restorative dentists, even the laboratory and the technicians in the office. So we can go ahead and actually design your smile, and you know exactly how things are going to turn out before we've even started.
Okay. Yeah. Now, we've talked. You say no more dentures. Nobody should be wearing a traditional denture. Elaborate on that.
There's just no reason for it. In fact, so much so, some dental schools have even made it a requirement for their students that they're not allowed to make a lower denture unless there's a minimum of at least 2 implants to hold it in place. Because what I tell my patients is that a really good lower denture stinks. And one that's less than really good will probably sit in a drawer because it's just useless. It's more of a pain in the neck to use, to be quite honest. There's so many reasons they don't like them. They feel self-conscious, they move around, they limit what you can eat. They sometimes remove some of the tastes and enjoyment of eating certain foods. There's the potential embarrassment if you're just say playing with grandchildren and you're bouncing around. You don't want something falling out. Same thing. There's a lot of very active seniors that may be dating, and they don't want the potential embarrassment while kissing that their teeth could be moving around.
So where you are in Jersey, I mean, are there a lot of people wearing like an upper lower denture?
There's a ton. We could probably literally fill up a football stadium, like MetLife Stadium, several times over. That's how many people could really benefit.
Is that right? And well, if it's so good, if dental implants are so good, why aren't all these denture wearers coming in to do this? To either get, I guess, a snap in, snap out denture or teeth that don't come out. What's your take?
I think that's a great question. I think for a number of reasons. One, a lot of these patients have been through so much dentally in their lifetime that by the time they got through all the root canals and crowns and failed dental procedures, getting their teeth out was almost like a relief. So now they have these dentures, absolutely. Now they have these dentures and they think, well, phew, finally I can breathe now, not go back to the dentist. And they might skip literally years, if not decades, before going back. So they literally may not know about their options.
Because they don't go to the dentist.
Exactly. And the other reason too that's very interesting is I've noticed that human nature is such that there's no fun in telling a good story. It's much more entertaining to tell a horror story. So very often, like sitting around a dinner table, a family dinner table, people might tell their horrific stories about, oh, my neighbor had all these implants that failed and she was in so much pain, et cetera, et cetera. So those are the stories, unfortunately, that they're hearing. I'll give you a quick example, too, of how this ties in with human nature. I remember when my wife was expecting our first daughter. She was just weeks away from delivering her. It was Thanksgiving time, and I remember all the ladies sitting around the table telling what I called their labor room war stories. And I remember just like tapping on the table and saying, excuse me, do you really think this is appropriate right now when she's ready to deliver in a couple of weeks? But nonetheless, that's the type of stories that people tend to tell more often
like
than the good
horror
ones.
Stories of dental visits.
Absolutely. It's just more entertaining, I guess.
So they don't know how easy it is.
No, that's the thing. Exactly right. They're not aware that with the procedures that we have available now, the predictability of the outcomes, the sedation that we offer patients. I tell patients you're not allowed to feel anything uncomfortable while we're doing your dentistry. And Randy, back to your original question about why a lot of these people are not doing dental implants. A lot of them think they're too old, which again is just not the case.
How old can you be to do this?
All right, I'll give you a perfect example. I have a patient, God bless him, he's 102 years old. He had his dental implants done in his 90s, and I remember asking him why he chose to do dental implants in his 90s. And his answer was startling. He said, why not?
Well, why would a 90-year-old want to do it?
Why wouldn't a 90-year-old want to do it? They still want to enjoy the foods that they want to enjoy when they're in their 20s. They still want to have the confidence of being able to smile without something moving around.
Okay.
They still want to be able to be active, and why not? If they're healthy enough, they should be able to.
So 90 is not too old to do this for implants?
Absolutely not.
70 is young. So if somebody says I'm 70, and I'm too old to do this. That's like almost ridiculous.
I'll tell you, when somebody's 70 years old we're talking about dental implants, and they say, well, I don't know if I want to do dental implants. I'm already 70. I shall tell you what, let's put together a plan based on how long you're going to live. How much longer is that?
At least 20 years.
They stop and they laugh because they realize the absurdity of the question. Nobody knows. We have another patient. She was 84 years old at the time, and she had been wearing a denture. Absolutely hated it because she just was not enjoying life. So after we had her implants put in and we attached her denture to those implants, I call every patient that night or the next day. And when I called her that night to see how she was feeling, she said something that was just so touching. She said, I actually enjoyed dinner for the first time in years, if not decades. And I have a quote from her on my website that's very touching.
Is that right? So when they get this done, how soon could they eat?
Depends on the situation. A lot of people go home and eat dinner that night.
Okay.
I have another patient too who is a World War II veteran. Loves to tell stories about what he saw, witnessed, etc. And he's just a super guy, very active. He's single, and Randy, I like to talk to patients before we put together a treatment plan. I want to get to know them more as a person, not as a body part.
Okay.
All right. And part of what I learned when talking with this particular patient is that he's a very active man at this point in his late 80s.
Okay.
Loves to do his Saturday night socials. And what he was finding was that people thought he wasn't friendly. He was single, so he would try to mingle with the ladies at the party.
Yeah.
And people mistook his personality because he wasn't smiling. And he just didn't feel comfortable because even the foods they were serving sometimes weren't easy for him to eat. And I have a photograph of him.
All right.
And basically what it shows is that he didn't have a nice smile, so it made sense that he didn't want to show it. So this fella came to us because he knew that his teeth weren't savable and that they were starting to hurt him and interfere with his life. So he was told that his only real option, based on the condition of his mouth, the amount of bone he had, was just to get a denture. So we went ahead and talked about other options that we knew could work very well for him to give him back his teeth.
Okay.
So he could function completely, enjoy his foods, go out to his socials, smile, feel confident, and just look like he was comfortable. And we have an after photo.
All right, so what'd you do?
We went ahead, gave him a couple of dental implants, and went ahead and put his teeth onto the implants so they're rock solid. So once again, he can enjoy the flavors of foods. He can eat anything on the menu. He doesn't have to restrict himself anymore. And most importantly, he's perceived differently. So now when he's out at a social function, people don't think of him as a grumpy old man. They see him with this bright, brilliant smile, that he's friendly and approachable. And this way he can be more social too at these parties that they have. I mean, the changes between the before and after photographs, you can just see that, first of all, he just looks happier. You can see it in his face. He looks younger even, because a smile does make you look younger as opposed to frowning where you look grumpy. Plus his teeth in the before photograph show that they really were not positioned well, so it just gave him the appearance of maybe coming from a bad background.
Okay.
All right. Whereas in the after photo, he just looks like a guy who's just happy as heck just to be around you. I have another patient here. I'd like to show you the before photograph. And a lot of people think when they come to my office, they say this line, I probably have the worst teeth you've ever seen.
That's got to be unusual, by the way.
Absolutely not. And that's what I say to these people. First of all, it makes them feel more comfortable. It's not the worst set of teeth I've ever seen. And it's not unusual. You just don't realize it because these people don't smile. So you can't see what's behind their lips.
You don't see it.
You can't see it. Exactly right.
Is there a lot of this then going on?
An awful lot.
They just never show their teeth.
Exactly right. And these people walk around and they're misperceived as far as how happy they are or their personalities. So this lady that I have the picture of here, she was coming out of a bad point in her life. And she decided it was time to turn the corner and do something good for herself. And don't we all deserve to do that? Do something good for ourselves? Okay? And she was going down a path where she was going to be losing teeth, and it was severely affecting her self-esteem. So we sat down and we talked about her options. And you know what? One of her biggest fears was that her only choice would be dentures. That was a fear of hers, and it actually kept her from moving forward with this great thing she wanted to do for herself.
Okay.
So when we sat down and we started talking about her options, you could see the excitement in her eyes.
All right.
All right. And we talked about that she could have something that would look better than what she had, be way healthier than what she had, and would give her back solid teeth that she could be proud of and really help her turn this corner in her life and get herself back on track. And I have an after photo here.
Let's take a look. Wow.
So Randy, can you guess what she had done?
No. What is it?
Great answer. That's what we hope for. We want our results to be naturally beautiful. So what we do is we sit down once the patient knows exactly which choice they want, and we really review how that process goes. And I want them to know ahead of time how they're going to look, even before we start the process. And we can do that because of this team approach that we have. So we have this all under one roof approach. In fact, we're known as New Jersey's premier dental implant team.
Yeah.
What that means is we have the surgeons, the restorative dentists, the full dental laboratory, and what we call our in-house dental artist, our laboratory technician. And we will design this smile. This happens to be a full, what we call reconstruction. So it's a full set of dental implants that looks just like she got her natural teeth back, only better.
Okay, so now do those come in and out? It's a snap in, snap out?
They are rock solid. She takes care of them exactly like she got a do-over on Mother Nature, and has a brand new set of teeth. So for her, we gave her teeth back, completely supported by dental implants. So they're rock solid. She can eat anything she wants. It's just like she got her natural teeth back, but way better. No decay. Because you got to remember, the chance of titanium getting a cavity, which had been her problem, her frustration her whole life, is zero. Metal doesn't get cavities. When we take our before photos, we sometimes have a difficult time. I'll explain what I mean. Patients who don't like their teeth have learned to not show them when they smile. So very often when we ask somebody, give us a nice big before smile, we'll get this. And I'm not making a joke, because
Smiling with their mouth closed.
Yeah, exactly. What we want to see is a tooth smile. But sometimes, and we have to threaten them that we're going to tickle them if they don't give us what we need.
Okay.
But eventually we get the smile, but it's not really a smile. It's more like a show me your teeth look. And when they're done and they really love and enjoy and are proud of their smile, I don't tell them to smile differently, but they do. You see the corners of the mouth go up more. You see a natural little fold that occurs between the nose and the outside of the lips. You see just a little bit of a squinting by the eyes. That's an unrehearsed smile. If you're at a comedy show and you just smile without thinking about it, that's the way it should look.
Okay.
And we routinely get this in the after photos.
So she obviously looks much different. She looks more sophisticated, even more attractive.
Yeah.
Just because of the teeth. You know, we talked in the green room, and I said respectfully, I go, yeah, but it's just teeth. Mm-hmm. And it was like fighting words for you. I mean, it's more than just teeth. Now, how important is a smile in your opinion?
You know what? I hear it every day from the patients who've had it done. So if I even were to forget, I get the feedback from patients about things that it's done for them, that it is so much more than teeth. In fact, let me show you this next patient.
Okay.
Now this is a young lady, okay? So a lot of people come to me and they are very embarrassed. They have a lot of emotional baggage on their shoulders because they truly are embarrassed about how they look. And they know that it's affecting them. They know that it's holding them back in life. I know that sounds big, but it's really true. So here's a young lady who's been losing her teeth for various reasons, we'll say it that way, and she's heading down the path of losing them all. So
and wearing dentures.
And wearing dentures. And that quite honestly scared the heck out of her, being so young and being single, that now if she goes to kiss somebody, is there going to be an issue? So she was justified in her concern. So we went over options that she was really excited to hear existed for her.
All right.
And as we got more into it, you could see the excitement building. So her options were dentures, which really frightened the heck out of her, right? She was not looking forward to that at all. So when we told her that we could give her back her teeth that would be fixed and rock solid in place and way better looking than she had, she was looking forward to the process.
Okay,
and I have an after photo for you.
Let's take a look. Very nice.
This is not the same person. I mean, if you look at her face, I mean, you can see she has changed. First of all, she looks younger, way more attractive, just more confident. It really has changed her life.
Now, your office, we should mention, I guess how, and we're a little bit short on time, but how dental implants are normally done is you go to one office that does the surgery, and then you go somewhere else for the imaging, and another doctor that puts the teeth on top.
Yeah.
Your office, you do both.
Absolutely.
Is that right?
Absolutely.
So aside from convenience, what's the big advantage?
Oh, huge. I learned really early on that no one person can be an expert at everything. And any office that claims to have one person who does everything, they're really fooling themselves and their patients, because you just can't do that. Okay? So in our office, and it's taken me many years to do, we've assembled, again, what we call New Jersey's premier dental implant team, where we have surgeons who have the best training. We have restorative dentists who have advanced training. We have laboratory technicians who have advanced training. And each person has their own position in the office and their own expertise. And that's how we move along. And it's well coordinated. I'd like to say that.
Does it cost more to go to, this team approach that you have?
Absolutely not. It does not have to cost more at all to go to somebody with this much experience and with this team approach. Not at all. So each person has their specific role. And I like to say that I'm sort of the quarterback on the team, because I know what the restorative outcome is going to be.
Restorative meaning what the teeth are going to look like.
I know exactly what their smile is going to look like, and the patient knows too before we even get going on any treatment at all. And then everybody from the surgeon to the restorative dentist, to the electronic. We do it digitally on a computer. We actually design the
So
smile.
they get to see what their teeth are going to look like first.
Absolutely. And the patient will come in, and this is the exciting part for the patient, because
right.
they can be as much a part of the process as they want. They can sit there with no mirror, our laboratory technician, and design their smile. They can say, oh, I always wanted teeth that were a little longer, or a little lighter, or a little rounded, whatever it might be.
The guy that makes the teeth comes out and meets them.
Sits right there with you with a computer in front of them. And we do custom shade matching, custom staining. He comes out like a little artist with a little palette of custom stains. So we can make this smile exactly what you've always dreamt of, but maybe Mother Nature never gave you.
Okay, now you brought a photo, and I said, well, you said, but could I just show a photo of the team? So we're going to show this photo. So these are the guys right here. Okay.
Exactly.
So this is your team, and,
Yes.
and most of the patients that come in get to meet everybody.
Oh, absolutely.
Is that right?
Absolutely, yeah.
People need to know. I'm not trying to side with you here. I'm just asking questions. But you're an artist, right? I mean, you draw and sketch things. Is that right?
Yes, that's true.
How does that apply to dentistry?
Well,
is it more art than science?
Oh,
It's
great
a mixture
question.
of both.
It is totally a mixture of both. You have to understand the biology behind it, but you also have to have that artistic eye. So, yes, I did do some artwork in the past, and I continue to draw. I love doing sketches of my children.
Okay.
And how has that helped in the office? Well, what we'll often do for somebody is what we call a mock-up. And it might just be 5 or 10 minutes where we take some filling material and put it over their teeth. And they then take a photograph
So
of
they
it.
get to wear like a new smile, look in the mirror first.
Yep. They get to get
What do
some
they say
idea.
when they see this?
Well, first of all, they get to see the result before it's ever been even close to started, let alone finished. And it gets them very excited because they see the possibilities, the real potential here. And we'll give them a photograph of this mock-up smile. They can bring it home, show it to their family, friends, whatever they want to do. And this way it helps them decide if this is the right option for them. We also have patients that as they start to lose teeth in their back of their mouth, it starts what I call a downward spiral. Because as you lose teeth in the back, you start to favor other parts of your mouth, and they start to become overstressed. And if you run out of the left and you run out of the right, you're kind of left with the front, just chewing like a rat. And those teeth were never intended to take that much force. And they start to break down as well. So we do have patients that come to us for a number of different reasons, such as, and I have a before photo for you.
Okay.
So this fellow, Randy, had some missing back teeth. The front teeth are starting to take too much force, and you can see them starting to wear down. So his initial thought process was that he just wanted to spruce up his smile. Nothing wrong with that, but we also had to tell him that we needed to address the missing back teeth. Or, look, I like to say that we're good,
Okay.
but we're not better than the big guy.
Okay.
All right? So if you can destroy or wear down or break what God made for you, we're not better than that. So we have to restore what's currently missing to prevent that from occurring again.
Okay.
And I have an after photo here that shows how we put not only his back teeth back, but restored his smile to the way it used to be when he was younger.
Okay.
And the result's pretty striking. So this patient that I'm showing you here, he's got a great personality, always did. I mean, his teeth never affected him, but he was recently divorced. He was out dating again and just wanted to feel better about his smile. So we did talk about, of course, his initial concern, which was making his teeth better, but we had to talk about the original cause of some of the problems that resulted in the teeth not looking good, which are missing back teeth. So we gave him back his back teeth with dental implants, and then we restored his smile to the way it was when he was younger with porcelain veneers. And he got exactly what he wants, and you can see how much improved he is. And take a look at how it's changed his entire appearance.
Yeah.
Between the before and after.
Yeah, he definitely looks more sophisticated.
He absolutely
Looks
does.
a lot better.
He's a super smart guy, great sense of humor, great personality, but it didn't look like that in the before photo. You might have misjudged him in his character. In the after photo, there's no doubt about it.
Okay. And most of this is done like in the same day. Is that right?
It depends. There's going to be some cases that are done the same day. You go home dramatically changed. So for instance, if you're doing a porcelain veneer case, you come in one day with your teeth the way they were, or how they were when you came in. But the day we put the porcelain veneers on, you're radically changed.
Okay.
Everything about your smile is different. And even though people are often numb, they're doing their darndest to try to smile for the photo because they're excited.
And the implant case is same thing, right?
Absolutely.
So you
Same
can
thing.
actually, because we talked, you said that they could go in on the day of the procedure, no teeth, walk out with teeth.
Yep, absolutely.
Is that right?
Yep. It's not every case, but there's many cases where we can do that. They walk out that day with rock solid teeth again.
Okay.
And I have a patient here I'd like to show you.
Sure.
And we have other patients that they may or may not be fully aware. They know they've lost a tooth or two, or maybe a couple, and a couple teeth may need to be worked on. But what they don't realize, but with our experience we know, they're heading down a path of losing their teeth.
Okay.
And what often happens, it's like a downward spiral that picks up speed as it gets worse. And if you think about it, that's not a dental thing. That's just engineering. So if you're losing teeth, the remaining teeth take more than their fair share of the chewing forces. Just kind of makes sense that way. So that's what I mean by it's a downward spiral that picks up speed. So I have a photo here, a before photograph of a gentleman who had started to lose a couple of teeth and knew that he wanted to do something with his smile. And just when we talked about what's going on with his mouth and he realized the extent of how he was going to be on track to lose all of his teeth, we spoke about how if we don't do something radical and he stays on that track, he will be losing his teeth at a young age.
Okay.
So we needed to talk in terms of changing the track you're on. So what we talked about is replacing the teeth that are missing with dental implants, so we have rock solid teeth again, and then for any teeth in the front, to do porcelain veneers, again, to complement the support that he has on the back teeth and give him back that smile that he had back in his youth.
Okay.
And I have a dynamite after photo too. And just take a look at the results. I mean, it's a dynamite result. He's got a great smile. And most importantly, we took him off that bad track that we're talking about of heading down the road towards dentures. So when you asked me before, should dentures become a thing of the past? Absolutely, they should. Because we have so many options to offer patients. I have another patient here that I'd like to show you before photograph, okay? This is a lady who decided that after she came over from Russia, she wanted to do some major changes to her smile. So we talked about some different options. Once again, there were some missing back teeth, which is super important that I bring that out because we need to address that as well. Or any work we do just to simply enhance the smile won't hold up as well.
Okay.
Okay. So I have an after photo too that I'd like to show you.
Take a look. Yeah. Very nice.
And we have a striking result here with a beautiful smile where she's proud to show it. And if you take a look closely about the before and afters, you'll see some things. They're subtle, but they really show how this is truly a happy smile.
Okay.
You can see some subtle differences. When she smiles in the after, the corners of the lips go up a little bit. There's a little bit of a fold called the nasolabial fold, which is natural. There's a little tiny bit of squinting. And it's what will happen if, say, you were at a comedy club and you weren't thinking about your smile, but you just started smiling and laughing. That's a true natural smile. In the before photo, you'll see there's a subtle difference. It's more of a forced smile, because when people don't like their smile, they don't show their teeth.
Okay.
Which just kind of leads to a whole persona, that the way people perceive them, which is not necessarily true. She's a very happy lady.
Now, what about people that are headed to dentures? They have like the bleeding gums, the bad breath, I guess periodontal disease. Are their gums too bad to do this?
No, in fact, the earlier we catch those patients, the better. Because the longer those diseased teeth stay in their mouth, first of all, very importantly, there's a medical reason for taking care of those teeth. It's called the mouth-body connection. So those teeth are infected, as you pointed out. There's bacteria in the mouth, and they don't stay put here in the mouth. They travel throughout your whole bloodstream, and they affect everything from our scalp to our toenails.
Okay.
It's a proven fact. There's an increased risk for stroke, heart attack, and all sorts of other nasty ailments. So when you talk about people that have gum disease, are they candidates? Absolutely. And the earlier we catch it, the better.
So you could remove those teeth,
Yes.
give them implants, even though they had bad gums.
Absolutely.
Okay.
Absolutely. And the sooner we catch it, the better, because the longer those diseased teeth stay in their mouths, the more bone those bacteria are destroying.
Okay.
And the more bone they destroy, the more we have to add backbone later on, which is doable. It's very doable, but it's just yet another procedure.
But isn't it true if you've been working dentures like 20 years, you can't do this? You don't have enough bone.
You know, Randy, that's an old concept. And for years, that was what we told our patients. But nowadays, that is absolutely not true. And we've had many patients that come to us from other offices and they were told they couldn't get dental implants, but we have the technology. We can help these people. We can go ahead and add backbone, place the implants, and they can have their teeth back. Rock solid teeth once again. So regardless of how long they've been wearing a denture, that's no longer something that eliminates them as being a potential implant patient.
Okay, good. What about pain? It seems very painful.
Another very common misconception. Now, granted, any surgery anywhere in our body can have some degree of swelling, bruising, black and blue. Absolutely true. But we have wonderful medications to help with that. And even more importantly, I have a lot of patients who are nervous. They're just nervous. And I tell my patients this, I promise you this, you're not allowed to feel anything uncomfortable in our office. Not allowed. I don't care if it's an x-ray, a cleaning, a filling, a dental implant, doesn't matter. You're not allowed to feel anything uncomfortable. And for those people who are nervous about having a procedure done, we offer them 4 different levels, everything from super light to super deep.
Okay.
And it's like a menu. We actually show it to them and say, what's of interest to you? And we'll talk more about it. And we'll help them decide how they can have the work that they want to have done in a way that is completely comfortable physically and mentally.
We are short on time, but what are the options for a denture wearer that goes to your office or somebody that you can't save their teeth, a full mouth of extractions? What are their options when it comes to dental implants?
We have a number of choices that we can offer patients, everything from placing as little or as few as 2 implants or 4 implants, and it snaps in and snaps out. So it does come out, but it's nice and solid, so you can still chew your food very nicely.
Okay.
Or another type of option is what we call fixed, and these are rock solid teeth. They don't come in and out. Very often we can remove them if we need to or want to, like for cleanings, things like that, but they're rock solid.
So you could do like 5 or 6 implants to give them a full arch of teeth that just stay in.
Absolutely. Absolutely. And the nice thing about that is, especially if it's the upper arch, we can remove whatever was covering the roof of the mouth when they were wearing dentures. And what's that mean? Well, they can sense the temperature of food better. They can enjoy the flavor of foods better. There's more room for the tongue. So if there was any sort of speech impediment because of the full coverage of the roof of the mouth, they don't have that anymore. And they really love that benefit. Some of our happiest patients are the ones who were wearing dentures and now switched over to dental implant supported teeth, because they know what they went through. They didn't realize there was such a better option that was open to them.
Is this one of those things where at the end of it, they go, I should have done this years ago?
Oh, we hear that all the time, Randy. And if you think about it, a lot of these patients have had their dental concerns for 15 or 20 years. So if you think about it, all those years they missed out on being able to smile well, enjoy their foods, feel more confident about themselves. And they often say, I just wish I'd done this sooner.
Is that right? And they're permanent. I mean, they can last for as long as a person lasts.
As long as you take good care of them, come in for your regular checkups, absolutely.
And they look real. They're all designed where you are. Everything's done right there, in-house.
No two are identical. So we actually custom design each smile for that patient's wants.
Okay, and what are you called? You're called the dental implant, what is it?
We're known as New Jersey's premier dental implant team.
Okay, good. Well, I want to thank you for coming on the show. Great information. So if somebody's watching this, final message, maybe their teeth are bad and they're headed to dentures, or they're already wearing a denture, but for whatever reason they're still afraid. Or they're going, I don't know, maybe I'm too old. This seems complicated. What do you say to them?
You owe it to yourself to find out what your options are. Once you know what your options are and we kind of give you enough information so that you can make a good, well-informed decision, then you can decide to move forward towards a much, much, much better option.
I want to thank you for coming on the show. Great stuff.
Thank you very much for having me.
Now, I know you have before and afters on your website.
Yes.
They're going to make an appointment. Did they get to see you on the consultation?
Absolutely.
We should mention Medicare, Medicaid does not cover this. Even the best dental insurance only covers a very small portion. Is that right?
That is true, but I got to tell you, Randy, most of our patients are financing this so that they can fit it in with their budgets and truly get what it is that they want to have done. We even have some options where it's interest-free. Our office pays the interest for you over a 12-month period. But yeah, most of our patients do some sort of financing.
Is this the happiest group of patients? That means people that had no teeth to give them their teeth back?
It's mind-blowing. These are the patients that are the most excited. For me, one of the biggest kicks I get is at the holidays. If somebody brings me in homemade baked goods, I mean, we're a dental office and they're coming to bring us something just as a thank you because they're that excited about how it's changed their lives. That's priceless.
Okay, good. I want to thank you for coming on the show.
Thank you very much for having me.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.